Ask the Expert. Here to answer your questions live on the air about red light therapy is Dr. Sonal Haerter. Okay, Jamie in Phoenix was kind enough to send a photo and a question. So she wants to know, how long is it safe to wear the mask, and is it dangerous to wear it too long? That is a good question.
So Jamie, I would stick to the box instructions because this all depends on, again, the wavelength of the device, also the intensity and the power of the device. So typically it's 15 minutes or 30 minutes, and I would stick to those because any longer could give you side effects. So I would avoid going any above the instructions.
And sometimes it's an automatic shutoff, isn't it?
So, exactly. And that's actually big error proof, so that when you have something at home, you're not going above that, time duration.
Over it. Okay. Ella from Chandler says, I've seen red light therapy offered at a tanning salon. Is this safe?
That's a great question. In general, red light therapy is safe and does not have a ton of side effects. Now, here's what I want Ella to know is if she has any conditions that she should not be undergoing red light therapy, for example, photosensitivity or a history of lupus or medications like doxycycline, tetracycline, or migraines, epilepsy, these are things, if you have any of those, you should not be getting any red light therapy. But in general, they are safe.
Okay, good to know. Terry says, are there other forms of light color therapy that are similar?
Oh, what a great question. So infrared light is, again, a deeper wavelength compared to red light. Also something that we use for joint pain or inflammation in your muscles to relieve muscle soreness. Some of these devices come in with red and infrared therapy. So they are in the same device. Now, green is being researched. Green light is also touted to be something that is actually good for anti-aging wrinkle therapy, but we are still researching that. We don't have enough data. Blue light is actually used for treatment of acne. But the thing about blue light is it can cause hyperpigmentation in certain skin colors, like darker skin color like mine. There is a tendency to cause hyperpigmentation. So I often say with blue light, talk to a dermatologist before you use that.
Oh, that was very interesting. Okay, Gail from Surprise says, can RLT or red light therapy help pain like with my arthritis?
Yes, the infrared light actually penetrates beyond skin into your muscles and in your joint. And so it's touted to reduce inflammation in your joint. So it can actually help with arthritis.
Oh, that's great. Okay, Anaya says, which face mask do you recommend buying that has the best results? $1 million question, right?
It is. Okay, so this is how I pick the best mask. Well, number one, what is it that you're more comfortable, hand device or a facial mask? So that's one. Is it FDA approved? Number three, what is the wavelength? That is something that you have to actually pay attention to. Not all red light devices are effective. So a wavelength of about 633 nanometers or 830 nanometers is effective for red light and infrared light therapy.
Got it.
Also, intensity about 40 is what you're looking for. So those two numbers, if you don't have it on the device, email the manufacturer to get that information before you invest in those devices.
Okay. Can I be too personal and ask?
Yes.
Do you use one?
I do. I just invested in one a few months ago.
Okay. Can I ask which one?
Yes. It's Omnilux, and it's not, I'm not sponsored. It's not gifted. I bought
We're just asking because we're nosy.
Yes. No, I think it's good to know. I just bought it based on those parameters. So I looked at what the wavelengths were, intensity, and this is a long-term investment. It's a little bit on the pricier side, but if you're looking at doing this 3 to 4 times a week for years to come, invest in a good one that actually is going to be effective.
Right, and a whole lot cheaper than getting it at the clinic.
Correct.
Yeah.
Exactly.
Okay. Sonal, thank you, and thanks for your honesty. We appreciate it.